Good morning, everybody, and welcome to our webinar. It's really exciting for us to be able to bring this to you. We have got Mieke Van Den Driessche, from Metagenics. She is the VP of Global Science and works in research and development on all the ingredients, and there's almost nothing she doesn't know about all the different supplement ingredients that you could possibly wish for. Just before we hand over to Mieke, we have today, the format of today's session will be that Mieke will give you about half an hour of the science, and then we'll go into a short chat. My name's Sarah Sharpe, and I am the Senior Nutritionist for Scientific Affairs and Education. And I'm going to just tell you a little bit of what's happening at Nutri Advanced and talk about a few of the changes with the products that we've got. And then we'll come back for a Q&A. So you'll get a really great chance to ask questions. So if you want to type those in the question box as we go through or save them for the end, that's great. So I shall hand you over now to Mieke. Thanks very much, Mieke.
Thank you very much, Sarah. Hello, everybody. So, like Sarah already introduced, I will talk about women's health, and then more specifically about strains that can help and support bacterial vaginosis and UTIs in clinical practice. So, if I go to the next slide, I'm sorry. Yeah. So let's say for today, I'll talk about, first of all, a little bit about some introduction on women's health. Women's health matters today. And then it all starts in the gut. And I'm sure that you all know about the importance of our guts and our microbiome, but it's more than only the gut. And I will briefly talk about gut immunity, gut brain, and the gut vaginal axis. And then some specific strains that will support women's health, like I already mentioned in the introduction. So let's start about, say some words about women's health. And women's health is important. And there are lots of women, and let's say women make up more than half of the UK population and nearly 50% of the workforce. And they are responsible, and they make let's say almost 85% of all the healthcare decisions. And more than half of the population also reported having a long-standing health problem. And we also see that, and we know that women have very specific needs. And when we think of healthcare, women have specific periods in their lives, and that's like pregnancy, menopause, and all those periods need very specialized medical attention and also specific research, because women are not like men. And they're also 3 times more likely than men to experience mental health problems. So let's think and let's study women a little bit more in detail. And a publication from a couple of years ago with a 10-year follow-up on looking at gender inclusion in biological sciences and in research showed that females remain very underrepresented in research. And there are only a few studies that really analyze the data by gender. And that's something that we see is changing now. Women's health becomes more and more important, and we see more and more clinical data and publications coming up specifically on women. So it all starts in the gut, and I'm sure that every one of you knows how important our gastrointestinal system is. And it's not only our gastrointestinal system, it's also our microbiome. And the GI system, the GI tract, is the entrance to our health, is the entrance to our body, an entrance to our well-being. So it's so important to keep our gut, our GI tract, our microbiome as healthy as possible. And it's like I said, it starts in the gut, but it's not only the gut. And as you can see here, you can see that the GI tract is linked to several other organs and several other systems. And especially the microbiome plays such an important role, not only to keep the microbiome healthy, but also, and as you know, there's the link, for example, with the gut-brain axis. But there's more than that. There's also the gut-brain endocrine axis, the gut-liver, the gut-pancreas. Something new and with a lot of new literature and science is the gut-skin axis. And we are talking about leaky gut, but we're also talking about a leaky skin nowadays. The gut-kidney, the gut-bladder, the gut-reproductive axis, gut-muscle, gut-bone, gut-lung is also something new from the last couple of years, is that link, and then the gut-heart axis. So it's all one, let's say, almost all one system. And that's why we also talk about the GI super system. And that GI super system is, it's all linked to each other, and it's all linked with our microbiome. And that's why it's so important to keep our microbiome in homeostasis. So this is what is mentioned here as well. It's the eubiosis of the gut microbiota. The more we have this in homeostasis, the better our microbiome is, the better our GI health will be, but the better that all the other axes will function and all the other organs and systems will function. And let's have a look at some of these, but very briefly, like I mentioned before, is, for example, the gut immune axis. So microbiome, on top of this slide, microbiome is related to immunity, is very much related to immunity. For example, if you look at metabolites, the short-chain fatty acids, they have several effects on several immune cells, on macrophages, on T helper cells, on monocytes, on neutrophils, and they all have specific effects on those immune cells. We also see the pattern recognition receptor ligands and some structural components. They will bind to a specific receptor. In this case, it's mentioned here from the dendritic cells, for example. So they will also have their effect on the immune cells. And then via the neurotransmitters and hormones, there's another way, the vagus nerve, via the vagus nerve. Also, the gut-brain axis will also have some effect on neuronal signaling. So gut immune, there's a very linked, this is very much linked and connected to each other. Then the second is the gut-brain axis, and here again you can see the microbiota on the bottom of this on this picture is linked to the brain, and there are several communication pathways that make that bridge between the microbiome and the brain. And one of these is through those microbial metabolites. Another one is through the enteroendocrine cells and the neurotransmitters and hormones. Another one is via the cytokines. And so they all pass through the circulation and then goes through the blood-brain barrier. So it's important also to keep a good microbiome. Is also important to regulate that blood-brain barrier integrity, the brain function, the health. And then the fourth communication pathway is again through the vagus nerve via the enteric neurons. So that's also an important pathway between the microbiome, the gut barrier, and then the brain cells and the brain function. So gut-brain, again, so more and more information becomes available on the communication between microbiome, gut, and the brain. Then the next one is the gut-vaginal axis. There's also a very close link between those two. And of course, if we look at the rectum and the vagina, these are very close to each other, and there's a direct translocation between the vagina and the rectum, that the bacteria can go from one place to another, and I'll come back on that later. So, but also microbiome will also have an effect on immune cells, and so there will be a regulation of the microbiota by those immunoglobulins, and also stimulating promoting a coating of the lactobacilli. And that's what we find in the vagina. The more lactobacilli that we find, the better and the healthier our vagina will be. There's also other bacterial components and metabolites and cytokines where there's that crosstalk or that bidirectional communication. That's also another way. And then the next part is then also there's a communication between the intestinal and the vaginal microbiome that is also involved in the metabolism of the estrogen. So specifically for women, it's so the microbiome can have an estrogen deconjugation, which will then increase the estrogen level in the circulation. That can help a glycogen accumulation in the epithelium, and having more glycogen will be an energy source for lactobacilli again, and will increase the lactobacilli in the vagina. So several ways, again, several communication pathways in that gut-vaginal axis. But of course, yeah, everything is fine if we have a perfect or a healthy microbiome. But as you all know, yeah, the modern world, there are lots of factors that can, yeah, create a dysbiosis, not a eubiosis and no homeostasis, but a dysbiosis. And as you can see here, it's our diet, it's some medications, infections, the environment plays also an important role, some chemicals and xenobiotics, and then our lifestyle. So all these factors can disrupt our GI super system I was showing before, and also, yeah, can create that dysbiosis. And one of the consequences of that dysbiosis is also a hormonal imbalance. And I already mentioned it before that our microbiome is important for our estrogen metabolism, and more specifically for the detoxification of our estrogens. So in a normal, let's say in a normal microbiome, estrogens are detoxified through the liver, phase 1, phase 2. Then you have a conjugated form that can be excreted in the urine or in the feces. So that's a way of excretion of estrogens. But then once we have an unbalanced microbiome, that will also disrupt the natural elimination of the estrogens. And so the deconjugation will happen through, let's say, some pathogens that will secrete the enzyme beta-glucuronidase. And so the conjugated estrogens will be deconjugated, and the deconjugated form will come into blood circulation again. And so these estrogens are reabsorbed instead of being eliminated. And so this can lead to some excessive hormonal impregnation and an increased risk of some hormonal disorders like PCOS, endometriosis, cancers. So it's another way of explaining how important the microbiome is and how important the eubiosis is, how important it is to restore the microbiome if we have a dysbiosis. And it's for hormonal balance, it's for a healthy vaginal health, it's a vaginal microbiome, it's for a healthy gut microbiome, it's for a healthy well-being, it's for our well-being, for health in general. So that's one of them. Yeah, the microbiome is central and will help the whole GI super system. And so bringing back the eubiosis or a good healthy microbiome, that is possible by some specific strains. And you all know probiotics, and I guess you all know that it's important to choose specific strains that have shown that they have a clinical effect. Not all strains will do the same, will have the same effect. So it's important to really choose and look for specific probiotic strains with specific clinical and scientific outcomes. And that's why I want to explain and give some clinical background on some of those specific strains that can support women's health. And so some strains will support the bacterial vaginosis and the UTIs. Others will more support the immunity or the gut brain or the mood and everything, stress and things related to brain. And so that's why I will come and present you some different strains working on those 3 different axes. So the first one, or the first 2 specific strains, is the Lactobacillus rhamnosus GR1 and the Lactobacillus reuteri RC14. And these are 2 very known, with lots of clinical trials, known strains for the vaginal support. And so if we look here at the ecosystem, the vaginal ecosystem, and how does that changes through our life, then you can see it all depends also on the estrogen levels. And you can see 4 different periods in a woman's life. And so the first period, childhood, pre-puberty, there's estrogen levels are, let's say, low. And so you have a low amount of lactobacilli. So these are the bacteria in the vaginal microbiome. So with a neutral alkaline pH. Once the women gets older and more in the reproductive age, the amount of lactobacilli will increase, and so you will have a more acidic pH. Once we go even later, the next phase is the perimenopause and the menopause phase. There you can see, of course, a decrease in estrogen levels, but also a decrease in lactobacilli, and then more acidic and more neutral pH. And once we look post-menopause, then even, of course, lower estrogen levels, but also lower amount of lactobacilli and a neutral pH. When we look at the vaginal microbiome, it's a little bit similar to, let's say, a kind of gut microbiome and gut, not in the type of bacteria, but also the barrier. You can also see a vaginal epithelium. You also see the immune cells. You can also see in the vaginal lumen, you can see bacteria there. And so in eubiosis, with a pH lower than 4.5, you have the lactobacilli. So these are the main, this is the main type of strains that are present in normal, healthy vaginal microbiome. And so if we look at the mechanisms of actions to keep that eubiosis, to keep the microbiome protected against the pathogens, it's the secretion of the immunoglobulins, IgA and IgG. And then you can see that also lactic acid and H2O2 are produced, and some antimicrobial peptides. On the right-hand side, you can see the vaginal microbiome in dysbiosis. So you can see specifically, you don't see almost no lactobacilli. You see other pathogens. The Gardnerella is one that is very typical for dysbiosis in the vagina. Prevotella is also one that we see often here. So, and you can see that there's a biofilm created here that blocks all those mechanisms of actions, all those therapeutic approaches. And what will happen is that there will be a lysis, a mucin breakdown, and then an epithelial damage and a whole inflammation with a pro-inflammatory response that happens. So that's the difference between the eubiosis and the dysbiosis in the vaginal microbiome. And of course, we want to keep that, we always want to have that eubiosis, and we will try to keep the vaginal microbiome very healthy due to giving the probiotics. And there are major modulators of that ecosystem, and these are all known things. We have stress, age, lifestyle, diet. The gut microbiota plays an important role. Of course, if some medication is taken, contraception, hormone replacement therapy, antibiotics, that can all disrupt and that can all have an effect on that vaginal ecosystem. What can we do? And of course, vaginal infections is a consequence of all those modulators as well. What can we do? Well, we can, from a natural way, we can give some probiotics to keep the vaginal ecosystem as healthy as possible. Because what do we see? Bacterial vaginosis is something that we see quite often. You see a prevalence of 29%, which is almost 1 in 3 women that can have bacterial vaginosis. And that's, of course, where that normal balance of bacteria, so those lactobacilli, is disrupted and replaced by an overgrowth of those other anaerobic bacteria. This is something that is seen so often, and it's associated with things like smoking, higher BMI, having a higher lifetime number of sexual partners. So it's something, bacterial vaginosis is something that we see very often, but most of the women with bacterial vaginosis report no symptoms. And if there are symptoms, well, what do we see then? It's the vaginal discharge, it's irritation, itching, burning, pain, a fish-like odor. So these are the symptoms that sometimes women complain about, and that can be linked to a bacterial vaginosis. Of course, having that those symptoms and the bacterial vaginosis, that can increase a woman's susceptibility to the sexual transmitted diseases, to HIV, to urinary tract infections. And there's also an increased risk of preterm labor and delivery, miscarriage, and postpartum complications, for example, endometriosis. So that all can be linked to the bacterial vaginosis. And so if we look at vaginitis, so that specific inflammation, what do we see? What is typical there is that we have a significant decline in those lactic acid producing lactobacilli. There will be a lower lactic acid levels in the vagina. There will be a higher level of the pH. The pH will increase and will be above 4.5. There will be a higher overgrowth of pathogens and the clue cells and some biofilms. The barrier is destroyed. There will be a pro-inflammatory response and pro-inflammatory mediator cytokines and TNF-alpha, for example, and then a persistent infection, which is very very difficult to treat because of those difficult pathogens. What can we do? I already mentioned that, is giving some specific probiotics. So, of course, what will those probiotics do? Well, we want to increase the amount of the lactobacilli. We want to keep the pH lower, an acidic environment, 3.5 to 4.5. We don't want to have those pathogens. We want the production of the bacteriocins by those probiotics. We want to stimulate the innate immune system. We want to create an anti-inflammatory environment and a restoration of the vaginal microbiome. And of course, it's not only about bacterial vaginosis, it's also linked to gut, it's also linked to the urinary tract, because there's such a crosstalk. And as you can see on the picture, they're all close to each other. The rectum, the bladder, the vagina, it's all so close, and the bacteria, they will translocate from one position to another one. So it's that crosstalk. So there's the gut-bladder axis. The GI pathogens can go into the bladder, and there will be E. coli can create a UTI development, for example. You have the vagina and the bladder. Vaginal dysbiosis can also create a UTI then. We have the gut-vagina crosstalk, and so there's also, if there's an intestinal dysbiosis, that will also influence the local vaginal environment. So it's all linked to each other. It's all one crosstalk. It's a bidirectional crosstalk and connection between the gut, the bladder, and the vagina. So what can we do about it? It's two specific probiotic strains. It's the GR1 and RC14, and I'm not going to go into details. I just want to show some of the clinicals that were done. So, for example, these two 60 days randomized control trial of 64 and 59 healthy premenopausal women, what was seen is that the number of the lactobacilli increased significantly in both studies. Both studies showed a decrease of pathogenic bacteria and yeast. They lowered the risk of bacterial vaginosis and yeast vaginitis, and there were no side effects. And so again, that was also in the second one. In the patients also with bacterial vaginosis, it was a predominant lactobacilli microbiome that was restored. And we also saw that the prevalence of asymptomatic bacterial vaginosis fell from 28% to 4% in the probiotic group, but not in the placebo group. Another one showed the Nugent score, which shows us where we are in, it gives a score of the bacterial vaginosis between 0 and 3. There's no BV, let's say between 4 and 6. It's an abnormal situation, intermittent phase, and above 7, it's a real bacterial vaginosis. And so you can see in the group that received the probiotics before, if we look after the treatment, there we see after 14 days already that there were already 22 women that had a score between 0 and 3. 12 were intermittent, and 1 had still a score between above 7. And if you look at the placebo group, it's completely different, and still a lot in the intermittent score had an intermittent score, and a lot and even more had a score above 7. Another study in adult women with vaginal infection, 6 weeks in 544 women with bacterial vaginosis. We saw that after those 6 weeks, 61% had again a restitution to a balanced vaginal microbiota in the probiotic arm, and only 27% in the placebo arm. And also 6 weeks post-trial, so after 12 weeks, we saw that the normal vaginal microbiota was still present in 55% in the probiotic arm and only 20% in the placebo arm. It's not only giving the probiotics only, we can also add probiotics to drug therapy that is given. For example, in this case, in this trial, it also increased the effectiveness of fluconazole in women with vulvovaginal candidiasis. So here you see giving 1 dose together with the probiotics or with placebo showed immediately, for example, here that after treatment with the probiotic, there was a percentage of women that normalized after vaginal discharge here, when 10%, only 10% still had some issues when taking the medication plus the probiotics, and the same for the candida presence. Only 10.3% had still some candida presence after those weeks, and so when taking the probiotics together with the medication. And the other one, again, another one with tinidazole, again seeing an antiprotozoal in 64 women with bacterial vaginosis. If we add the probiotics to the medication, we can see that after taking the probiotics or the placebo together, we see that there are only 12% that still had the bacterial vaginosis, in comparison with when they got the placebo only together with the medication. Still 47% had the bacterial vaginosis. And then the last one, also for antibiotic resistance, we see here it's with the product called Bactrim, is the maybe better known as the TMP SMX. We see that the E. coli resistance was still very high 12 months after taking that 12 months together with the probiotics, and 3 months post those 3 months later. And we see if we give the probiotics, then it's very low, and it also, the E. coli resistance is way lower when giving those probiotics together. Another strain, and then it's not for vaginal, but more for gut, brain, and immune support, is the DDS1 strain. So here you can see, this is a trial in 330 patients with IBS, giving the DDS1 or the placebo. And so we can see the outcome of the abdominal pain severity rating scale. We see that there is a significant improvement when taking the DDS1 strain in comparison with placebo. And we see that 52% in the DDS1 group had more than 30% reduction in abdominal pain in that scale, in that symptoms, which was a very significant outcome. There's already a significant outcome after 21 days and an even higher outcome after 42 days. Another part of that trial, that was the IBS symptom severity scale, and again a similar outcome with that DDS1 strain in comparison to a placebo. We see a significant improvement in abdominal pain severity, duration, abdominal distension, in bowel habits, and quality of life. And then the last part of this trial is also showing that there's a normalization in the stool consistency. When we see after 42 days, we see that in the DDS1 group, 84% had normal stools in comparison to 62 in the placebo group. And so there were almost no hard stools anymore when taking the DDS1 in comparison to placebo. And then also the quality of life outcomes. We also saw an improved quality of life, IBS quality of life scores after 42 days, which was significant better than in comparison with the placebo group. Then we have another strain that can help women for gut and immune support. It's the bifidobacterium, the BB12 strain. So here we look at bowel habits in healthy adults, and we saw that in a large group of 1,248 with a low defecation frequency, so a low amount of stools per day and per week. So they were randomized to get this probiotic or the placebo for 4 weeks. And there we also saw the defecation frequency above baseline for at least 2 of the 4 intervention weeks. Another one in elderly nursing home residents that got the BB12 in a drink compared to placebo, and they also had the ones with the probiotic had more frequent bowel movements than the placebo group. And then the third one is the microbiome recovery, and that's also when taking antibiotics. Of course, the GI homeostasis is completely disrupted. The microbiome goes in dysbiosis, and there is a gut impact, there is a microbiome impact, and like I showed in the beginning, there's an impact on everything. And so this was a group of 62 adults receiving antibiotics together with a probiotic or with a placebo. And we also saw that there was a significant reduction that the BB12 protected against the antibiotic-induced fecal short-chain fatty acid reduction beyond 40 days. And so also the ones receiving BB12 had a faster return to a normalized microbiome or microbiota composition in comparison with the placebo group. And then the last one is the Lactobacillus plantarum, LA33, or the Clapius strain, which is a new strain with great clinical support for gut and brain as well. And so this is a study in IBS-D, so D from diarrhea, randomized to getting the Clapius strain or the placebo for 8 weeks. And again, there was really both doses of 1 billion or a 10 billion of the Clypius significantly improved the primary outcome of the IBS symptom score. And we also saw that there was, again, an improvement of abdominal pain, severity, duration, distension, the bowel habits, and also quality of life. And so also has some effects on the gut-brain axis. And so stress was also studied, and also the stress levels or the stress score significantly improved at 8 weeks versus placebo, and the quality of life improved as well. So in summary, let's come back. Women's health is important, and we need to have data also on women, which is not always the case, but which is something that is changing. But what is important is, if you look at the gut is central, but the gut and the microbiome plays a role is in connection with the brain, is in connection with the immune system, is in connection with the vaginal and bladder function, and it's especially there for women, also for the estrogen and the hormonal balance. But it's so important to have a great microbiome to avoid the bacterial vaginosis, or to treat them, or to treat or prevent in prevention of UTI, but also in prevention or helping the stress and the GI and the immune function. So it's all related, it's all linked, and keeping a perfect, a healthy microbiome is so important for all the rest. And therefore, we need very specific strains that have shown the clinical outcome, showing that they improve the vaginosis or improve the microbiome or the gut or immune axis. So that's my summary. Keep your microbiome as healthy as possible. So thank you very much.
Thank you very much, Mieke. That was absolutely amazing. I love it all starts in the gut side with all those different gut axes that shows you just how important the gut is. So just while you all type in any questions that you have, I am going to just share with you some things that are happening at Nutri Advanced. So as I said before, my name is Sarah, and I have worked at Nutri for a long, long time. So you may know me, or you may have heard me lecture before. So I'm probably well placed to tell you all about what's happening with Nutri Advanced and Metagenics and what that means for you guys. So as you can see at the top there, we've got the dual branding on this presentation. So we became a part of the Metagenics family, I think it's nearly two years ago. And in the background, all during that time, we've been working really hard to align. For those of you who don't know, Metagenics is a huge global nutraceutical company. They started about 40 years ago in California, and they have facilities now across the world, in Australia, in Europe, in America, and they've just acquired their distributor that was AmiPro in South Africa. So really, truly global. And what this means is that we get to share a lot of the science. So anybody who's been with us for a long time, so Nutri have been going about 45 years now, and I've been here for about half of that nearly. So we used to have Jeff Bland come over. We used to have a lot of the Metagenics speakers come over because we were the exclusive distributor for Metagenics. And then when Kennedy, who started Metagenics, was ready to move on, who started Nutri Advanced, was ready to move on, then it felt like a really natural choice. So what this means for us is that we are able to really get into the science and share some of those benefits. So as Mieke has just brought to you some of the work that they've been doing in Europe and across the world and in America on these strains and looking what they can do, and now we get to share that with you guys. So I just wanted to take you through what's going to happen in the next 12 months. You may have already started to see that some of our new packaging is coming through. So we are really taking advantage of, all the fantastic resources that we get at Metagenics. So our probiotics, which many of you will know as Ultra Probioplex range, they are an existing Metagenics product, and we are just bringing it in line and all under the same umbrella name so that we can hopefully bring you some more exciting formulas as well. So Ultra Flora probiotics will be changing, as some of those have already changed. They're really great clinically tested strains. They've got research behind them, and they've got consumer kind of end studies as well. So we get loads of really good feedback about what's working and about how people are using it. And that means that we can share that with you and pass that on. We're also going to be looking at the Meta Relax Magnesium. So over the next few months, you'll start to see lots of exciting new formulas and new looks for existing formulas that we have. So the Ultra Flora range are really leading the way on this one. So we have our Ultra Probioplex Duo, our Bacterial Regular, and our Ultra Probioplex ND. As you can see, they all look quite different before, but now they're going to be all under the new branding, and it will still be the same formula, and it'll still be the same quality. So it's just bringing it under a new look. And then next year we'll be probably introducing sort of new information to go with those as well. What I really wanted to highlight for you as well today is that we've got the Ultra Flora Complete for Women, which is a new product that we've been able to bring into this range and really sort of make it really simple for you to find which formula you want. And this contains 4 strains to give you 5-in-1 benefits. So I just wanted to very quickly introduce it for you. It is on our website now, and you can purchase it. So this one, what I really like about this and what I think differentiates it from some of the others that you can find is that rather than trying to convince somebody that they need to take 2 different probiotics, so one for their female health and one, and the urogenital tract, and one for kind of all those other gut, brain, gut health, gut immune kind of axes, then you've got it all in one formula. This is the new look as well. So on the front, it'll try to talk about what it's going to do for the client, so that your clients can understand what it is and what it's going to do for them, and it helps you to explain. And I love that whole part that Mieke has just done as well on looking at women's health. And I know that one of the questions that we get is, why should I take a probiotic for my vagina? I don't understand. I know it's good for my gut, but why is it good for my vagina? So definitely dig into that material at the start of the webinar and use that to help form your answers. It was just amazing. So this one, the strains that are in here, they do provide support for the GI tract, but for that, essentially for that gut-brain axis, that gut immune axis, and the gut urogenital. So that's both the bladder and the vaginal axis as well. It's just 1 capsule a day. We sort of look at the research that Mieke has just presented, and you can see that there's like results starting to be seen in as little as sort of 4 to 6 weeks. I think one of the studies was like as little as 14 days, but I tend to sort of look at a whole pack to get started with, and then to keep that pH down below 4.5, you want to start getting those results. And get that over time. It gets to work in 30 minutes. So it's starting to work in 30 minutes. It stays active in the digestive system for 24 hours. And we know that these sorts of strains, they tend to reach the vagina in as little as about 7 days. So you get that translocation. So you're starting to see benefits, relatively quickly. And what I really like about this formula, like I say, is that it's got those wellness benefits, those everyday wellness benefits, as well as then sort of helping with vaginal and overall vaginal microbiome. And this means it can be taken as an everyday probiotic for women, ongoing, and you're looking at those people who are looking to just protect themselves and build that healthy microbiome, rather than waiting until they're at a phase where they have a bigger hole to dig themselves out of. So the ingredients, we've got what we like to do at Nutri Advanced, and this is what Metagenics does as well, is to look at the science. It's really that science that brings balance, and we look at what the dosages that are used in the studies. So there's 1 billion of each of those, which gives you that really nice coverage, and it's really effective. And then we've got some tools and resources just to sort of really strengthen and back what you'll be telling and talking to clients about. So we have some really great research materials that we can share with you all. And then just a few bits about the product quality. So being part of Metagenics means that every product that we bring to you has gone through amazing production. It's not just about the ingredients, it's about how we put that together, how that gets into the capsule, how we deliver that to you. And all our probiotics have this Protect Air technology, which then assures that it's getting to you in a form that is going to still be viable and to get really good responses. So, and it means you don't have to keep them in the fridge either, which is great. It's suitable in pregnancy and breastfeeding. We'd say from age 12 up for this one. Suitable for vegetarians and those who are dairy free. The vitamin D3 in this product is from lanolin, which is a vegetarian source but not vegan source of D3. And it's also free from allergens, so it's really nice that we get that quality. So we're slowly introducing all of these different products. It's really exciting. You're going to see a lot from us in the next few months in particular, but over the next 12 months as we shift over to becoming fully Metagenics, and we're very excited about that. If you've got any questions, you can contact us at advice@nutriadvanced.co.uk, and you can contact us to just talk through what this means. Everything else will stay the same, so the website will still be accessed the same way. You'll keep your passwords and all that sort of thing, so it's all going to be nice and easy. But if you do have any questions or anything to share about the new look or any of the new formulas that we bring in, then we'd love to hear that. So I know that you've all been furiously typing away. So I'm going to go through some of the questions now. Mieke, let's go through the questions. So we have somebody saying that they had a client who had a, excuse my pronunciation on this, but is it a Bartholin cyst, which is a cyst of the labia blockage. Are there any particular strains that you'd recommend for recovery with that one?
For a Bartholin cyst, oh no, and I'm not sure, and I haven't seen anything in the literature either, so I don't know if that has been studied ever, and no, I cannot recommend any strains because I haven't seen that in the literature either. So I think there it's more, some more conservative things to do is, the kind of drainage trying to have, of if really needed, is more surgery, I think, but having some probiotics there, I don't know of any literature giving any specific strain for that. No, sorry.
So you mentioned that with bacterial vaginosis, that if somebody has many sexual partners, that can have an influence. How about if somebody's partner has had many sexual partners? Does that have an influence?
It's a little bit the same. Hey, it's the microbiome that goes from one to the other. Eh? So someone has a specific gut microbiome, vaginal microbiome. So like I said, there's that translocation of of the bacteria. So it all depends on, yeah, if you have several partners, you get in contact with several bacteria, with other bacteria, let's say, and other pathogens, for example. If your partner have had several contacts with other partners, then yeah, it's your contact with your partner. So it's all about the translocation.
Yeah.
So
Thanks
yeah.
very much. You mentioned the biofilm with bacterial vaginosis. Do you need to work to break down the biofilm?
Yeah, sometimes if the biofilm is really hard, and sometimes can be hard to break down, the probiotics will definitely help, and they will help to create a healthy microbiome or a vaginal microbiome. So probiotics is definitely a possibility that can help break down the biofilm. Also, some of those I mentioned, the antimicrobial peptides, or those can also help breaking down, but that's also you need to have a good microbiome, a good immunity, and then those can also help to break down the biofilm. And otherwise, it's antibiotics. That's then, let's say, a next step. If the probiotics alone cannot do the work, it's the antibiotics in combination with the probiotics, because if you give your antibiotics, you will destroy your microbiome, but adding at least probiotics, and you have seen that in some of the trials, but just in general, anyone who takes antibiotics, please add some probiotics to have, once you stop taking and you can give them together. It's not that if someone takes antibiotics that the microbiome will become sterile, or that your gut or so will become sterile. So you can definitely give them together. The most important thing is when you stop taking your antibiotics, that you continue to take your probiotics, because then there is a faster restoration or normalization of your microbiome. So please continue a couple of weeks after stopping your antibiotics. So that would be my suggestion: probiotics, and then if needed, antibiotics to break the biofilm.
And that's fantastic. Somebody has asked about, with UTIs and Candida, are baths advisable? So it's mixed research, mixed sort of opinions out there. So somebody's been told by a nurse that with Candida don't have a bath, whereas Epsom salt baths and ACV might be quite helpful.
Yeah, and it's not only Candida, I think it's also the bacterial vaginosis. Often it's more recommended to not have a bath because there are also bacteria there, and to prefer a shower instead of taking a bath. I think it's, let's say, safer, because then you don't bring other possible pathogens, bacteria in contact. So it's easy, let's say it's safer to take a shower instead of a bath.
Yeah. Okie doke. So somebody else with recurrent, I think that's UTIs. She's been on several antibiotics for the past 3 or 4 years, prone to constipation, got some kidney stones, worked on GI function, and she's much better, but still gets UVI about every 6 months. Which probiotic would you recommend?
Yeah, I'll leave that up to you. I would say the ones that has the prevention in the UTIs, it's the GR1 and the RC14 at least, but it's the total. It's keeping as a prevention, is keeping your microbiome as healthy as possible. So I would do the total of several bacteria.
Yeah.
Probiotics.
So somebody's asked, are these okay to use vaginally?
That's a good question, and we have been thinking of that as well. It hasn't been tested, but usually capsules will dissolve. It will take a little bit longer if you take them for vaginally than orally. It hasn't been tested, so I don't dare to say yes, but
Yeah.
I think so.
Yeah.
The solution is quite fast after a couple of minutes of a capsule. So, but yeah. no data on that.
Okay. Somebody's asking the strains in Ultraflora Complete for women. So it is the GC1 and the RC14, along with the Clepius and the BB12. So yeah, but all the slides and all the notes are in the handout section, so you can download those. We'll get those sent out as a email afterwards as well. And like I say, it's on the website now, so you can look on the website there. Any particular timing for taking the probiotic? Would you take it with or without food?
Is that a question for me?
Yes, sorry, yes. Yeah.
Well, the probiotics are resistant against the gastric acidity. So in fact, if you take them with or without, it shouldn't make any difference because they survive the acidity. So you have, it depends, if you eat, you will have less and more, and so it shouldn't make any difference.
Okay, and what time of day would you recommend them?
Doesn't matter.
Yeah.
But
so,
I would recommend to take them always at the same timing of the day.
Yeah, I always say that the best time is the time that you'll remember to take it.
Yeah.
So,
that's a good answer.
That's what I think with these, some of these ones that we can keep out of the fridge now with that Protect Air technology. That means that you can just stick it at the side of the bed and take it at night, or you can have it by your toothbrush and take it when you brush your teeth. So it does mean that you've got it somewhere rather than having to always think, oh, I need to go to the fridge and get that. So yeah, so you can keep it where you're going to remember.
Yeah.
Does this help with bloating and SIBO-like symptoms?
Yeah, definitely. Yeah. I've shown some data on bloating and IBS symptom score, and that contains one of the questions there is bloating. So this will definitely help to reduce the symptoms, and SIBO is maybe another question. It might help SIBO, but it will not be, let's say, immediately. It may take longer to treat the SIBO. If you have a real SIBO, it may take some longer time, but yes, it will definitely help and reduce the symptoms.
That's great. Would this be helpful for clearing chronic candida, especially in older women such as 80 plus?
That's a good question. And what I often recommend is to alternate. So you have specific products for candida with some herbals and some other specific products, and I would alternate them, like the products, and I'm sorry for that, I don't want to mention any names of what Nutri Advanced has in the portfolio because I don't know exactly, so I leave that up to you. But what I often see has the best outcome is alternate the real candida product with some probiotics. And one of the ones that is really working well for candida is the Saccharomyces boulardii, the SB. So that is often alternated. So that's maybe a solution to help to treat the candida.
Yeah, we have that one, and we do have a range of herbal sort of anti-candida. You can either email in or you can phone in, or I can just let you know that it's on the website as well. If you search for that, you can find them quite quickly. Somebody just recommending serrapeptase to break down the biofilm, taken on an empty stomach, 20 minutes, and then later take the Ultraflora. So thank you for that comment. Let's see.
Yeah,
I
that's
know
true.
that
Some
we are,
enzymes can do that as
yeah, and
well.
we're
That's
a
true.
little over, so thank you everyone for bearing with us. We've got one more question and then we can wrap up. So, with leaky gut as a result of overuse of antibiotics in the past, would this help with mitigating the leaky gut symptoms?
Yes, of course, because if you restore your microbiome, you will also have a restoration of your enterocytes and of your gut barrier. So you definitely will have some improvement of the symptoms, because a healthy microbiome is like the basis that will also keep your gut barrier, and of course lowering your leaky gut and improve your symptoms. And it will not only help to lower your leaky gut, but like I mentioned, you have also a leaky skin and also an effect on your gut-lung axis, for example. And it's the whole GI super system. So yeah, probiotics is like the way to go, not only for the microbiome, but also for the gut barrier integrity, but also for the other organs. Like the
Yeah.
summary of my talk.
Yeah, I really like that. I really like that slide. It all starts in the gut. So I think that's a great way to explain the importance. So thank you very much for your time today, Mieke, and for taking us through that research, and for answering all of those questions. I do want to just remind everybody that it is the last day now for our 4 for 3 offer on the website. So if you did want to top up on any of your bacteria, requirements for yourself over the holidays, or for any of your clients, then today is a good day for it. And yeah, we will get this sent out as a recording for you, and we hope to have much more news for you in the new year. So thank you very much, everybody, for your time today and for all of your great questions. Thanks, Mieke.
Thank you. You're welcome. Bye-bye, everyone.
Bye.